Hey guys, just a reminder, this is not official medical advice. For such, please seek an appointment with a licensed medical provider.
Welcome back, everybody, to another episode of Explain This. I'm with the star of the show, Robin Riddle. Robin, how is it going?
It's great. How are you?
It is wonderful over here. I'm in North Knoxville. You're in West Knoxville. But we're here together. We're recording another episode, and I'm so pumped about this topic because, one, in our practice, I hear about it a lot. I have a general understanding, but we're gonna dive a bit deeper today, and we're talking about Clomid and another word I can't pronounce, so I'm not even gonna try.
So we're talking about Clomid versus Enclomiphene and kind of explaining the differences and uses between the two.
Should we start with Clomid? Just how people see it. What's your thoughts on that?
Yeah. So Clomid is probably something that most people have heard of, especially if you've done anything in the fertility field, because that's typically where most people are hearing about Clomid.
Okay.
So Clomid is the brand name for a medication, clomiphene citrate. It's a medication that's been used for decades to treat infertility in women. We use it for ovulation, induction, things like that for women. It's also very commonly used off-label for men, especially in functional and integrative medicine, to help stimulate the body's natural production of testosterone and to increase sperm production.
So when I think of it, that's what I think of.
Right, yeah, and we use it a lot for that in our practice. So Clomid is what's called a SERM, S-E-R-M, a selective estrogen receptor modulator. So what it does, it actually works on the brain. It blocks the estrogen receptors in the hypothalamus and the pituitary of the brain. So it makes the brain think that we don't have enough estrogen in the body. So this tricks the brain into releasing more gonadotropins. So FSH and LH are the two signals that we're getting the brain to release more of. These hormones then go and stimulate, in women, they stimulate the ovaries, or for men, it actually goes and stimulates the Leydig cells that are in the testicles, getting those cells to produce more sex hormones. So for women, estrogen, progesterone. For men, we're producing more testosterone and more sperm.
And okay, so these are all we're using it to produce more of that.
Mm-hmm.
Okay.
Yeah.
Okay.
Yeah.
Okay.
So Clomid is something, again, for women, it's more just fertility related. So they're either doing that in a fertility clinic or sometimes I will use it in my fertility practice. But for women, I'm not using it very much. It's more focused in men for us. So Clomid itself is a mix of two isomers. So it's Enclomiphene and something else called Clomid. So that's where the differentiation comes between Clomid and Enclomiphene, because Clomid is a combo of these two isomers and Enclomiphene is just a pure version.
So Enclomiphene is a part of Clomid, and Clomid is Enclomiphene and the other one you mentioned.
Yes, the Clomid. So Enclomiphene is the active isomer of Clomid.
Okay.
So Enclomiphene is primarily responsible for stimulating the brain to release the FSH and LH. So it has a shorter half-life than the other isomer, the Clomid. So its effects are a little bit more predictable and shorter acting. And so traditionally, we've used more Clomid in our practice, especially again with men, because Clomid is what has been readily available to us. Enclomiphene is becoming a little bit easier to get as a standalone drug. As far as I know right now, it still is only through compounding pharmacies. That's the only way that I'm getting it. But it is becoming a little bit easier to get. And so that's why I wanted to talk about it today and talk about like where we would use the Enclomiphene versus the Clomid in practice.
So based on what I'm hearing, you would use Enclomiphene the same way you would use Clomid. It's just going to be more effective.
It's more effective or more focused.
Okay, got it.
Yeah.
Got it.
Yeah. So in men, the enclomiphene is what's helping to naturally produce testosterone without suppressing sperm production.
Okay.
The zooclomiphene, the extra little isomer that Clomid has, it's the longer acting portion, and it is more estrogenic, meaning it's more likely to create estrogen side effects. So
And that's bad.
that's not really what we want,
Okay.
especially for men.
Okay.
For women, that's what we need when we're using it in the fertility standpoint for ovulation induction for women. But for men, not really what we're looking for.
Okay.
So if you put them side by side, Clomid and Enclomiphene, they're going to do the same thing whenever we're talking about for men specifically. So they're going to help with infertility for men. They're going to increase that testosterone production, increase sperm production. Clomid is just a little bit more likely to have some estrogenic side effects because of that zooclomiphene in it, where the enclomiphene is a little bit less likely. Now, we can still have estrogenic effects either way. We can still increase estrogen levels, and we still have to watch for that potential side effect. It's just a little bit less likely to happen with the pure form of the enclomiphene.
Is the fact that it's shorter acting, is that a negative for enclomiphene or
No,
not?
because either way, we're dosing it about the same.
Okay.
We're just a little bit less likely to have side effects.
Okay.
So some men on Clomid never have the first issue. They feel fantastic. But sometimes we do hear about like mood swings and just more of those estrogenic type effects. So we can even start to have like some chest tenderness if those estrogen levels are getting really high. And so again, with the enclomiphene, we're just a little bit less likely to see that.
Okay. Okay. Super interesting. And
Yeah.
the reason this is kind of a hot topic is just because of access to enclomiphene.
Yeah, so we've got, I'm in West Knoxville, so we're located right next door to our compounding pharmacy, Heartland, who's now known as Hillstone. And this is something that they're making for us now.
That's
And
amazing.
they were asking me about it, and I'm like, oh yeah, this would be a great topic because now that I have easier access, I'll probably start transitioning a lot more patients to the enclomiphene side of things.
Is there any patients that you would consider using Clomid over enclomiphene, or is this like hey, this is better, and if they can, let's go to enclomiphene?
My personal opinion in
Yeah.
research, I would probably move to enclomiphene.
Okay. Okay.
Again, in my practice specifically, working on the fertility side of things, I could still use Clomid for females, like for anovulation, PCOS females, that kind of thing. But there's even better medications there now. I'm a bigger fan of letrozole whenever it comes to needing to induce ovulation. So in general, kind of moving away from Clomid.
Interesting. So you're not even using it on the female side at all, really?
I'm not a huge fan of it. A lot of the traditional fertility clinics, that's the first thing they start out with is Clomid. And they'll do a couple rounds of Clomid for women. They'll do Clomid with IUIs. The thing with Clomid is it does stimulate, your estrogen and everything like that we need for ovulation, but it can kind of turn down mucus production for women. So that cervical mucus, which is what helps sperm to move through the cervix, it reduces cervical mucus. So it actually kind of almost puts a barrier to pregnancy, which makes no sense whenever we're trying to get pregnant.
Right.
And then it can also thin the uterine lining, so we don't build up as much of a cushion for the baby that we're trying to make.
Got it.
So there's medications that don't have quite the same level of side effects. Plus, a lot of women feel a little psycho on Clomid, where they don't so much with other ones. So the less crazy we can feel, the better.
That's right.
But talking more specifically about clinical uses for Clomid in men, the patients that I'm thinking about this for are the patients who have lower testosterone but want to preserve fertility. So they don't want to move into testosterone replacement therapy, which can decrease fertility. So if they're either actively trying to get pregnant or think they're going to be trying to get pregnant in the near future, this medication would definitely be something that we would discuss versus just starting on testosterone therapy.
And this is a dumb question. I apologize, Robin. Clomid, are you using for that purpose? Are you using Clomid with testosterone or in place of testosterone?
Depends on the situation. So if I
Okay.
have a patient who is actively trying to get pregnant, or they know that they're going to be trying to get pregnant soon, I honestly don't recommend any testosterone replacement with that. I would only recommend Clomid or HCG.
Okay.
And sometimes I even have to do a combination of the two, depending on the patient.
Okay.
If we've got a patient who wants testosterone replacement therapy, but wants to keep their body also producing some of their own natural testosterone, that's where I would do a combination of testosterone and Clomid.
Got it. Okay.
So we always have that conversation. TRT can really shut down fertility. It's not an adequate means of birth control, but it definitely can suppress production. There are studies out there using testosterone replacement alongside Clomid and or HCG and keeping that fertility on board. And I've done a podcast about that previously.
Yeah.
But the more that I work with fertility in real time practice, I don't see fantastic results there. So if patients come to me and they're like, hey, we're trying to get pregnant and I want testosterone, I usually tell them it's not a great option. I've had a few patients that have been able to conceive keeping testosterone on board and just adding in Clomid or adding in HCG, but it's just not the norm of what I see.
Okay.
So I usually would go just to this for someone who is looking to keep their fertility on board.
Is there any other that's kind of the main use of Clomid in men? Is there any other reasons you might use Clomid for men?
No,
Okay.
it's just if we want to be fertile, or again, if even for men who aren't looking for fertility, if they don't want to cut their body's signal off.
Yeah.
Because straight TRT, testosterone replacement therapy, has a negative feedback loop and it suppresses your FSH and LH signals. So the body quits sending the signal to produce your own testosterone. And some men just don't like the idea of that system being shut down. So Clomid can help with that.
I mean, yeah, honestly, thinking about myself, I would definitely at least explore that option first. And then, of course, if you get to a point where you're not producing any more testosterone, then, or it's less likely that you are, then, then going the TRT route. But that's a conversation that, you've got to have with the patient just to see where they're at,
Yeah,
with that.
absolutely. So I'm always asking, that's like first question. I don't care if you're 20 years old or 55 years old. I'm going to ask you, are you planning on having kids?
Yes.
Do we need to keep fertility? And then you do have some patients who are like, hey, I don't want to go the TRT route at all. Like, I'm not trying to get pregnant, but I only want to do something natural.
Yeah.
And Clomid can come in a situation like that as well.
Is Clomid
or Enclomiphene?
Is it considered natural?
It's a medication, but we're using the medication to push a natural process.
Got it. Okay, so it's not like, because it's not replacing it.
Correct.
Okay, I'm with you.
Yeah. So when I talk to patients about TRT or about lower testosterone levels, I give them the option of supplements, stimulators, or testosterone. And Clomid is a stimulator.
Makes total sense.
Yeah.
I want us to clip that. I think that's important. Like, because I haven't, we don't talk enough about, the supplements and the stimulators, because there's definitely options out there.
Yeah, there really are. And so with Enclomiphene becoming so much more readily available, that gives us an even better option. Because the thing with Clomid that I always warn people about is Clomid, with the way that it works, it can increase something called sex hormone binding globulin, SHBG. So SHBG binds to the testosterone in the bloodstream. So the more SHBG that you have, the more your testosterone gets bound up or locked up. So this can lead to lower levels of free or bioavailable testosterone, which is the type of testosterone the body can actually use. So with Clomid, you can see testosterone levels start to go up. So if you start somebody on Clomid, T levels can start to go up, but their free T will either not change or go down. Not every patient that we see this in, some patients do great on Clomid, but it does have the capability of increasing that SHBG. So then we end up kind of stuck in this vicious cycle of like, hey, we've got good looking total testosterone, but we're not feeling better. Then you check that free testosterone and you see why they're not feeling better, because you've not changed their free testosterone levels any. So a lot of times, if we can switch over to Enclomiphene, we're going to have less of that estrogenic effect and less of that sex hormone binding globulin stimulation. So we can increase that total and that free testosterone without having as many negative side effects.
That's interesting. I did not realize that Clomid could kind of get stuck in that cycle. And, you know, we talk a lot about total testosterone versus free testosterone. That's super interesting. And I mean, a big reason why to just go with Enclomiphene.
Yeah. Now, if you're using Clomid along with testosterone replacement therapy, TRT actually lowers your sex hormone binding globulin. So we're less likely to run into that issue of high SHBG if we're using Clomid along with TRT.
Okay.
Just so you know.
Okay.
Yeah. Enclomiphene dosing is very similar to Clomid dosing. So it's not a big change there. Most people are going to start on either 12.5 or 25 milligrams daily of the Enclomiphene. Usually 25 milligrams daily is my max on Enclomiphene, and it's the same with Clomid. It's 25 milligrams a day.
And it's is it, dumb question, shot or
pill?
Pill.
Compounded pill form.
Okay.
Yeah.
Okay.
Yeah. Some people will even go as low as 12.5 milligrams every other day. So if you have a patient who's like super sensitive, you might need to start a little bit lower. But typically 12.5 to 25 milligrams daily is pretty standard dosing for this Enclomiphene.
When you say sensitive, does that mean like they're just not going to feel good on it, or?
Potentially, yeah.
Okay.
Some people are more susceptible to the estrogenic effects of Clomid or Enclomiphene.
Got it.
And so in situations like that, you may want to start a little bit lower. And then, of course, you've got to monitor labs. So looking at total and free testosterone, FSH and LH levels to make sure that those are rising as expected, monitoring estrogen levels to make sure we're not going too high with estrogen. And if fertility is the goal, then we're also monitoring a semen analysis to make sure that we're getting the results that we want there.
That is super interesting. I mean, as we're talking here, it just feels like Enclomiphene's just the way to go if this is, you know, the route you want to take. You know, but like you said, I'm sure there are, you know, cases where, you know, you would want to use Clomid, but it's funny. I've not heard of Enclomiphene. So this is,
well, again,
wild.
because it's not been as readily available.
Okay.
So it's been one of those things like you can read about it in blogs and people talk about Enclomiphene, but actually getting it in practice has been much harder for us.
Got it.
So now that we're gaining easier access to it, I think it's a great option to give patients. That's
amazing. Robin, is there anything else you want to make sure we go over in this episode of Explain This for Clomid and Enclomiphene? Anything else that you think the audience needs to hear?
I think that pretty well covers it.
Guys, that is Clomid and Enclomiphene. Again, you did it again, Robin. I didn't even know this existed, and here we are. We explained it. And I certainly do appreciate it. Robin, thank you for the time today.
Absolutely.
Guys, you name it, we explain it. We will be back next time.
Don't go away.